Imagine lying on the couch after a heavy dinner. Everything is fine until suddenly you feel a burning sensation in your chest. At first, you might think, it's just a simple case of heartburn. But the reality is that it could be a sign of something more serious, a hiatal hernia. A hiatal hernia means that part of the stomach is passing through the diaphragm and entering the chest cavity. Some people never notice this problem, but for many, it can cause pain, severe reflux, and digestive issues. Interestingly, according to statistics, about 20% of the adult population in the United States experiences acid reflux symptoms weekly, and a significant percentage of them have some form of hiatal hernia. This issue becomes more common with age. Over 60% of individuals over 60 years old have varying degrees of hiatal hernia, even if they are unaware of it. The main problem is that the symptoms of a hiatal hernia often resemble simpler conditions like indigestion or heartburn. This leads people to take it less seriously and to delay seeing a doctor. So, if you want to take your digestive and heart health seriously, join me as we explore 7 important signs of a hiatal hernia, signs that may seem harmless at first glance but could be key to understanding an underlying problem. First sign, heartburn. Imagine lounging on the couch after eating a greasy pizza or a spicy meal. It doesn't take long before you feel a burning sensation in the middle of your chest. That feeling of burning and heat that starts from behind the breastbone and sometimes rises to the throat is the well-known heartburn. In a hiatal hernia, part of the stomach moves above the diaphragm, and the valve that should act as a tight door between the stomach and esophagus weakens. As a result, stomach acid easily enters the esophagus. Unlike the stomach, the esophagus has no protective lining against acid, which is why direct contact with acid causes that painful and irritating burning sensation. This symptom typically occurs 30 minutes to 2 hours after eating. Foods like chocolate, coffee, citrus fruits, tomatoes, and fast foods are the main triggers. Lying down or bending over also intensifies the symptoms. This is why many people say, at night when I sleep, my heartburn gets worse. According to studies, over 60 million Americans experience heartburn at least once a month, and in many of them, a hiatal hernia plays a hidden role. The important risk here is that the pain from heartburn can sometimes be so severe that it is mistaken for a heart attack. The difference is that heartburn usually improves with antacids and does not radiate to the arm or jaw. However, any chest pain should be taken seriously, and the first step is always to seek immediate medical attention. What can you do? Eat smaller meals. Do not lie down for at least 2 hours after eating. Limit trigger foods like coffee and chocolate. Elevate your pillow a bit while sleeping. Regurgitation. Regurgitation is different from regular vomiting. In vomiting, the contents come from deep within the stomach or intestines and may have a bile color. However, in regurgitation caused by a hiatal hernia, food usually comes back from the upper stomach or lower esophagus to the mouth. Patients often describe this material as a combination of sour taste and the flavor of recently eaten food. This can happen quite suddenly and even in normal situations like talking, laughing, or doing everyday activities, something that can be both annoying and embarrassing for many. The volume of the regurgitated material also varies. Sometimes it's just a small amount that is swallowed again, but other times a large volume comes up, and you may need to expel it. Frequent reflux can cause serious problems in addition to discomfort. Over time, stomach acid erodes tooth enamel, leading to decay. Additionally, continuous contact of acid with the throat can cause burning, irritation, and even hoarseness. According to studies, individuals with persistent reflux are twice as likely to experience tooth decay and throat and laryngeal issues compared to others. What can you do? Limit activities like excessive laughing, bending over, or heavy exercise after eating. Take oral hygiene seriously and rinse your mouth with water after each episode. If regurgitation occurs frequently, consult a doctor to prevent damage to your teeth and throat. Difficulty swallowing, dysphagia. Sometimes patients with a hiatal hernia say, it feels like food gets stuck in the middle. This sensation is what we refer to as dysphagia or difficulty swallowing. When part of the stomach moves up through the diaphragm, the normal pathway of the esophagus changes. This alteration in shape can lead to narrowing or disruption in the natural movement of food. As a result, swallowing food, especially solid foods, becomes difficult, and the patient feels like food is stuck in their throat or chest. Sometimes, drinking liquids is necessary to help the food move more easily into the stomach. This difficulty in swallowing is usually intermittent, meaning that some days there are no issues, while on other days it can appear suddenly. Triggers can include stress, certain foods, or eating too quickly. The psychological impact of dysphagia should not be underestimated. Many patients develop anxiety around eating, which can lead to reduced food intake and may result in nutritional deficiencies. Some even avoid eating in public due to embarrassment or fear of food getting stuck, which can affect their quality of life and social relationships. This symptom can sometimes be mild and only occur with certain foods, but in more severe cases, even liquids can be difficult to swallow. Some patients may also lose their desire to eat due to pain or frequent obstruction, leading to weight loss. According to statistics, about 15 to 20% of patients with a hiatal hernia experience varying degrees of difficulty swallowing. This symptom is significant because it can indicate inflammation of the esophagus or a more serious narrowing. What can you do? Chew your food thoroughly and take small bites. Use liquids while eating to make swallowing easier. Eat dry and hard foods with caution and reduce stress while eating. If you have frequent or severe swallowing problems, be sure to consult a doctor and undergo necessary examinations, such as an endoscopy. Early satiety. Imagine you've eaten a few bites of food and suddenly feel like you can't eat anymore, even when that amount of food would normally be sufficient for you. This condition is called early satiety. In patients with a hiatal hernia, part of the stomach moves up above the diaphragm, which reduces the stomach's capacity and alters its normal function. The displaced stomach cannot expand properly to accommodate more food, so signals of fullness are sent to the brain earlier than usual. This sensation is different from the normal fullness experienced after a complete meal. Patients report feeling an uncomfortable sense of fullness after just a few bites or even a few minutes into eating. This situation can be frustrating, especially for those who previously had a normal appetite and could easily consume regular meals. The anatomical cause is that the protruding part of the stomach is constrained by the opening of the diaphragm, reducing the stomach's actual capacity and disrupting its natural ability to expand and accept food. Additionally, this alteration may slow gastric emptying, meaning food stays in the stomach longer. If this problem persists, it can lead to unintentional weight loss and nutrient deficiencies, as the patient cannot intake enough calories and essential nutrients. Some individuals adapt by eating small, frequent meals, while others still face nutritional issues even with this approach. The severity of this symptom can vary, some days it's worse, and other days it's better. Triggers include stress, certain foods, and the position of the displaced stomach. Some patients find that liquid calories are easier to tolerate, leading them to rely more on smoothies, soups, and nutritional supplements. Bloating and belching. Imagine that after a meal, your stomach feels like a blown-up balloon, and you experience heaviness and pressure. This is exactly what patients with a hiatal hernia experience, severe bloating and gas accumulation in the stomach. When part of the stomach moves up above the diaphragm, the normal pathway for gas movement and food digestion is disrupted. As a result, air and gas become trapped in the stomach and cannot easily be released through belching. Patients often describe this sensation as feeling full of air or like having a balloon inside their abdomen. This condition typically arises during eating or immediately after a meal and can last for hours. Bloating can sometimes become so severe that the abdomen visibly enlarges, and clothing around the waist feels tight. The body attempts to relieve gas by belching, but in hiatal hernia cases, belching may not help, and patients might burp multiple times without feeling any relief. The sources of gas in these patients include swallowed air during eating or drinking that gets trapped in the displaced stomach, increased food fermentation by bacteria, as slowed gastric emptying allows food more time to produce gas. Certain foods and drinks can exacerbate the situation, carbonated beverages, as they introduce extra gas into the stomach. Foods that naturally produce gas, such as beans, cruciferous vegetables, and high-fiber foods. Many patients can reduce discomfort and better cope with this symptom by identifying their personal trigger foods. What can you do? Limit gas-producing foods and carbonated beverages. Gradually consume high-fiber foods and gas-producing vegetables in small amounts. Eat slowly and chew well to minimize swallowed air entering the stomach. If you experience severe or persistent bloating, consult a doctor for strategies to reduce gas and improve gastric emptying. Imagine waking up in the morning and finding that when you try to speak, your voice is hoarse, rough, or weak. You have to constantly clear your throat to be able to talk. This condition can result from stomach acid refluxing into the larynx and vocal cords in patients with a hiatal hernia. The larynx is the area where the vocal cords are located, responsible for producing sound. When these sensitive tissues come into contact with stomach acid, inflammation and irritation occur. This condition is known as laryngopharyngeal reflux or silent reflux, as it often appears without the classic symptoms of heartburn or acid regurgitation. These symptoms usually develop gradually and are more noticeable in the mornings after a long sleep in a lying position. Patients may not only experience hoarseness but also chronic sore throat, the sensation of something stuck in the throat, or a constant need to clear the throat. The throat may feel dry, irritated, or inflamed, and some individuals may even develop chronic coughs to clear the acid from their throat. The timing of the symptoms is also an important clue for diagnosis. If they are more severe in the morning, it likely indicates nighttime reflux. Some patients notice that their symptoms worsen after eating or consuming acidic foods. If acid reflux continues chronically, it can lead to more serious issues: inflammation of the vocal cords, throat ulcers, increased risk of respiratory infections, chronic sinusitis or postnasal drip. In severe cases, increased risk of throat cancer. What can you do? Sit upright after eating and avoid food for at least 2 to 3 hours before sleeping. Avoid acidic foods and beverages. If you have chronic hoarseness or sore throat, consult a doctor to initiate appropriate treatment for managing reflux. Chronic cough. Imagine going to bed at night and suddenly starting to have dry, irritating coughs that won't stop. You haven't caught a cold, and you don't have allergies, but your throat is constantly irritated. This is exactly what many patients with a hiatal hernia experience. The main cause of these coughs is the reflux of stomach acid into the esophagus and throat. When the acid rises, it irritates the walls of the throat and airways, and the body responds by coughing to protect itself. Doctors refer to this condition as reflux-induced cough. These coughs are typically chronic, meaning they last for weeks or months and do not improve with regular cough medications. Interestingly, many times the patient does not have any classic symptoms like heartburn, which makes diagnosis challenging. According to studies, about 10 to 20% of patients with unexplained chronic cough are actually suffering from reflux and hiatal hernia. The coughs often worsen at night or after lying down, and some patients wake up in the morning with a dry, irritated throat. If left uncontrolled, this condition can lead to inflammation of the vocal cords, lung irritation, and even asthma-like attacks. What can you do? Avoid eating food 2 to 3 hours before bedtime. Elevate the pillow slightly to keep the head above the stomach. Avoid irritant foods and beverages like coffee, alcohol, and spicy foods. If the cough lasts more than a few weeks, consult a doctor to investigate the underlying cause. Awareness is the first step in caring for ourselves and our loved ones. If you found this video helpful, please share it with others. This simple information might save someone's life. Until next time, stay informed and healthy.